million Americans deal with each and every day. From back pain to arthritis, joint pain, headaches, doctors are now starting to get a better understanding of chronic pain and how to best treat it. And it's the cover story in Time magazine this week, Understanding Pain. Jeffrey Kluger is a science editor for Time, and he joins me this morning. Thanks so much.
Thanks for having me.
When we talk about more than 70 million Americans dealing with chronic pain, what are we talking about in terms of what they're feeling?
Well, one of the things that makes pain such a confounding thing to try to treat is that there's so many variations of it. We all know the subjective experience of pain. There's cutting pain, there's sharp pain, there's dull pain, there's a throb, there's that chronic sort of pain that can wreck your day, and the other kind of pain that can just keep you never quite enjoying yourself. And the sources of pain are as varied as the experience of pain. So there's so many different ways to try to crack this puzzle, and often it'll take a specific treatment for each kind of pain.
So what startled you the most out of all of this research and out of all the varying different articles? You had 4 different articles in the actual cover of Time about this. What do we not know about it?
Well, I think one of the things that a lot of people are struck by is how poor our ability to manage pain is. Chronic pain is the #1 cause of people presenting in emergency rooms, and 80% of those people walk away with no pain, no effective pain relief at all. And this is one of the reasons that the Institute of Medicine several years ago decided that pain must now be assessed as sort of the 5th vital sign. There's blood pressure, heart rate, respiration, and temperature, and now pain is considered that 5th vital sign.
And because it's so subjective, I mean, they can take your blood pressure and they can see what that is. They can take your temperature and get a number. How do you assess pain?
Well, there are a number of ways to do it, and you're absolutely right. Think of all the people who've been in chronic pain their whole lives and have been accused of malingering because there's no way of determining objectively. But now there are other ways to do it. Functional magnetic resonance imaging, fMRI, that shows the brain in the process of operating in real time. You can see where the pain centers are, you can see when they're activated, you can see when they're not activated. There are also studies of blood chemistry that show where your vasopressin levels are, where your cortisol levels are. And all of these are chemicals that are related to the experience of pain and also exacerbate pain. So there are objective measures for pain.
It's interesting that we talk about not really effectively treating people's pain, yet we hear so much about narcotic and opioid prescription drug addiction and what a big problem it is in the country right now. I mean, is that an effective long-term way to help people that are in pain?
No, it's absolutely not an effective long-term way to do it. And you're right. The problem, of course, becomes that these things are wildly addictive. So even when you get your first 30-pill prescription for Vicodin or Percocet after you have a tooth pulled, there's another story I did in which folks were talking about the term Pharmageddon, what this country is going through, and they described those kinds of one-time prescriptions as your little opioid starter kit. That's you're on your road to addiction.
And you talked about in some other alternative therapies, and just sometimes people scoff at that. Acupuncture, oh please, right. Biofeedback, or even a exercise regimen that eventually leads to being able to not be in pain. Which ones have proven to be most effective, and for what?
Well, all of these things are effective. One of the pieces in the package written by a gentleman named John Cloud explored all of these. And what we're finding is massage, for example. Massage can change those levels of chemicals in your blood, of vasopressin, of cortisol. A single massage can actually cut these levels dramatically. And what we're also finding is that it sometimes doesn't even have to be that expert laying on of hands by people who really know what they're doing. Simply random touch at any points in the body can do that. Acupuncture, similarly, does lower levels of stress chemicals and increases levels of natural endorphins and opiates. The thinking being that a needle stick is just enough of an injury for the body to say, I'm under attack, this is an assault, I need to release opioid chemicals. And funnily enough, it also, in the case of acupuncture, sometimes random placement of needles can be as effective as needles being placed along the precise meridians.
That is amazing. Well, I invite people to read more about it. Everybody knows somebody that's dealing with this and feels almost like a prisoner in their own body, and it's very difficult.
Absolutely.
Anyway, it was great to talk to you. Jeffrey Kluger, thanks so much for joining us this morning.
Thanks for having me.